Think about the people you know who are in their 80s or 90s. Are they thriving or are they surviving? Are they still independent, able to walk, cook, remember conversations, laugh without pain, or are they dependent on others for everything, locked into cycles of prescriptions, surgeries, and hospital stays? It doesn't have to be that way. In the United Kingdom, one hospital study revealed that nearly 60% of elderly patients admitted for chronic illness were also malnourished or eating less than 2 servings of vegetables per day. In Canada, many long-term care homes are feeding seniors processed food with barely any fresh produce, fish, or legumes, yet wondering why memory and muscle mass deteriorate so rapidly. Australia faces similar patterns in its aging population, where loneliness, sedentary lifestyles, and poor diets combine into a dangerous cocktail. The data is screaming for change, but few are listening. The United States has normalized medication as the first step instead of food. But if your blood pressure is high, if your cholesterol is rising, if your joints ache, or if your energy is crashing, it's not a deficiency in pharmaceuticals. It's a deficiency in nutrients that your body needs to function and heal. Beans can regulate blood sugar better than some diabetes medications. Leafy greens reduce arterial stiffness more effectively than many statins. Turmeric fights inflammation without destroying your gut like NSAIDs do. Olive oil nourishes your heart while margarine slowly poisons it. These aren't small differences. These are life-altering shifts. But people have to make the choice, daily, consistently, for years. The emotional cost of ignoring diet is massive. A daughter watching her mother forget her name. A husband feeding his wife who can no longer move her hands. An elderly man falling in the shower because his legs no longer support him. These are not just random tragedies. They are often the predictable outcome of decades of nutrient neglect. People fear cancer but keep eating food that fuels it. They fear dementia, but avoid berries, nuts, and greens that protect the brain. The irony is heartbreaking. In America, the cost of chronic disease exceeds $4 trillion annually, and yet the average adult consumes less than 2 servings of vegetables per day. That disconnect is killing people slowly. Imagine how many lives could be changed, extended, and enriched if every meal became an act of self-preservation instead of self-destruction. And we're not just talking about adding years. We're talking about the quality of those years. In the blue zones, people don't just live longer. They live better. They remain active, involved, and respected in their communities. Food is not just fuel. It's connection, celebration, and healing. A 101-year-old woman in the U.S. who gardens, cooks from scratch, and hosts Sunday dinners said her secret isn't some superfood, it's consistency. Every day she eats her beans, her greens, her fish, her olive oil. No excuses, no shortcuts. She never bought into the idea that fast food saves time, because what's the point of saving time if you spend your last decade in pain, confusion, or a hospital bed? Some people say they don't have time to cook, but that same person might spend 2 hours a night watching television. Some say healthy food is expensive, but they spend hundreds every month on supplements, fast food, takeout, and medications. The real question isn't whether you can afford to eat like this, it's whether you can afford not to. Because the cost of not eating this way is your future, your independence, your identity. In the United States, Medicare is drowning under the weight of diet-driven disease. But the solution is sitting in your grocery cart. Lentils instead of deli meat, salmon instead of fried chicken, broccoli instead of chips. These changes are simple, but they're not easy, because they go against decades of marketing, habits, and misinformation. But the people who break that cycle, who say no to processed convenience and yes to vibrant, healing food, they're the ones walking at age 95. They're the ones remembering birthdays at 101. They're the ones still waking up with purpose. Important message. If you are experiencing leg cramps, numbness, swelling, restless legs at night, burning feet, or difficulty walking, you may be missing critical nutrients that your legs absolutely need. These are not just random symptoms. They are warning signs that the nerves, muscles, blood vessels, or connective tissues in your legs are under attack. The title 10 vitamins will save your legs is not an exaggeration. In the United States, where leg pain and neuropathy are skyrocketing. Due to nutrient-poor diets, these vitamins could mean the difference between walking freely or losing mobility forever. The first and most essential vitamin to talk about is vitamin B12. This is the most commonly deficient vitamin among adults in the United States, especially those over 50, those taking acid blockers, or anyone following a vegan or low-meat diet. B12 is critical for the myelin sheath, the protective covering around your nerves. Without it, nerve impulses get disrupted, leading to tingling, numbness, burning pain, and in severe cases, muscle weakness and coordination issues in the legs. It's absolutely terrifying how many people end up in wheelchairs or need walkers simply because of undiagnosed B12 deficiency. It's especially common among people with type 2 diabetes, who often take metformin, a medication that depletes B12 levels. In fact, if you're in the United Kingdom, Canada, or Australia, and you're taking diabetes medications and experiencing pins and needles or foot pain, you might be suffering from this exact deficiency. B12 from food sources like beef liver, sardines, and pasture-raised eggs is more absorbable than synthetic versions, but many people need methylcobalamin supplements, especially if they have gut issues or older age. Next is vitamin D3, another vitamin with massive consequences for your legs. Over 40% of adults in the United States are deficient, and the number is even higher in northern regions of Canada and the United Kingdom. Why does this matter for your legs? Vitamin D plays a crucial role in muscle strength, nerve signaling, and calcium regulation. Deficiency causes muscle weakness, poor balance, increased fall risk, and even higher pain sensitivity. It also contributes to vascular calcification, meaning your blood vessels become stiff and narrow, especially in your lower extremities, where circulation is already harder due to gravity. Studies show that people with higher vitamin D levels have better walking endurance, lower rates of peripheral artery disease, and fewer complaints of leg pain. You need both sun exposure and supplementation to get enough, especially in countries with long winters. Then comes vitamin K2, specifically the MK7 form. This vitamin is critical for pulling calcium out of soft tissues like arteries and veins and redirecting it into your bones. If you have hardened arteries in your legs, varicose veins, or cold feet despite warm weather, this may be your missing piece. In the United States, many people overconsume calcium through fortified foods and supplements, but never balance it with K2. The result is calcium building up in the blood vessels, especially in the legs, leading to reduced blood flow, heaviness, pain, and even ulcer risk. K2 also supports elasticity of the arteries, which is essential for proper circulation. The richest source is natto, a fermented soybean product common in Japan, but K2 is also found in grass-fed dairy and egg yolks. Most people in Canada and Australia don't get enough, making supplementation a wise choice, especially if you're taking calcium or D3. You also need vitamin B1, or thiamine, especially in its benfotiamine form. B1 is essential for converting glucose into energy, and low levels cause nerve pain, especially in the legs and feet. In fact, a thiamine deficiency can mimic diabetic neuropathy almost perfectly. Many Americans with burning legs and tingling toes have no idea they're actually thiamine deficient, especially if they drink alcohol regularly, eat processed foods, or suffer from blood sugar issues. In one clinical trial, high doses of benfotiamine reduced nerve pain scores by over 50% in diabetic patients. The United Kingdom and Canada have rising rates of sugar-related nerve damage, but no one is being told about this vitamin's healing potential. If your legs feel like they're buzzing at night, or your feet feel like they're burning from the inside, thiamine could be the life-saving vitamin you're missing. Vitamin C is another one most people ignore until it's too late. Vitamin C builds collagen, which is the structural protein in your skin, veins, arteries, muscles, and connective tissues. When your vitamin C levels are low, your veins become weak, leading to varicose veins, spider veins, and even bleeding capillaries in the legs. It also means that injuries in the legs take longer to heal, bruising happens more easily, and inflammation sticks around longer than it should. People in the United States who rely on fast food and processed meals often don't get enough of this essential vitamin, even though it's readily available in foods like bell peppers, citrus fruits, and strawberries. Vitamin C also acts as an antioxidant, protecting the inner lining of blood vessels, which helps reduce leg swelling and improve circulation. Next is vitamin E, but not the synthetic form commonly found in low-quality supplements. What your legs really need is tocotrienol-rich vitamin E, a potent form with powerful anti-inflammatory and circulation-boosting effects. Tocotrienols can help prevent oxidative damage to the arteries, protect the nerves, and even reduce atherosclerotic plaque buildup. Studies have shown that tocotrienols reduce inflammation markers and may even protect against the nerve damage seen in people with diabetic neuropathy. In the United States, where oxidative stress and inflammation are at an all-time high due to processed seed oils, this form of vitamin E is extremely helpful. Unlike regular tocopherol vitamin E, tocotrienols can actually repair and regenerate tissues in the lower limbs, helping to restore proper blood flow, reduce numbness, and relieve aching legs. Another underrated vitamin that helps save your legs is vitamin B6, especially in its P5P form, which is the bioactive version. B6 supports nerve communication, and deficiency can cause burning feet, restless legs, irritability, and muscle twitching. In the United Kingdom, many patients experiencing leg discomfort are being treated for mental health issues or given painkillers, when the real issue is B6 deficiency from years of poor nutrient intake. B6 also works together with B12 and folate to reduce homocysteine, a compound that increases the risk of blood clots and vascular damage, especially in the lower limbs. This is especially important for people in the United States dealing with chronic inflammation or taking medications that deplete B vitamins, like certain birth control pills or hypertension drugs. Let's also talk about folate, specifically in the methylfolate form, which is more bioavailable than synthetic folic acid. Folate plays a role in DNA repair, red blood cell formation, and nerve tissue regeneration. Deficiency in folate can lead to poor oxygen delivery to the legs, leading to fatigue, heaviness, and poor recovery after physical activity. Folate is also essential for reducing homocysteine, just like B6 and B12. When homocysteine builds up, it damages the vascular lining, leading to narrowing and stiffness, especially dangerous in the small arteries of the legs and feet. In the United States, where processed grains are fortified with synthetic folic acid, many people still have folate deficiency because they can't convert folic acid properly due to genetic mutations like MTHFR. These people need methylfolate supplements and should focus on natural food sources like leafy greens, asparagus, and lentils. Vitamin A is also essential for leg health, though rarely discussed. This fat-soluble vitamin supports immune repair, skin integrity, and mucous membrane healing, which matters when dealing with chronic ulcers, slow wound healing, or skin infections in the legs and feet. This is a real concern for diabetics, obese individuals, or people with autoimmune issues in the United States and Canada. Vitamin A deficiency can cause dry skin, poor immune defense, and even vascular fragility, all of which affect the lower limbs. It also helps maintain nerve function and supports the health of the spinal cord, which directly affects nerve transmission down to your feet. Foods rich in vitamin A include grass-fed liver, pasture-raised eggs, and dark orange vegetables like carrots and sweet potatoes. Finally, vitamin B2, or riboflavin, plays a central role in mitochondrial energy production and detoxification. Low B2 levels can contribute to chronic fatigue, leg weakness, and muscle soreness, especially after physical exertion. In the United States, where high-sugar, low-nutrient diets dominate, Mitochondrial dysfunction is extremely common, and it often shows up first as physical tiredness in the legs, even when the rest of the body feels fine. Riboflavin is also essential for the activation of other B vitamins like B6 and folate, meaning a deficiency here can snowball into multiple system failures affecting the legs. Food sources include almonds, beef, eggs, and dairy, but it is also commonly taken in B-complex supplements when nerve symptoms are already present. These 10 vitamins aren't just suggestions, they're essential components your legs require to survive, function, and heal. If you are struggling with burning feet, numb legs, cold calves, swollen ankles, or crippling nighttime cramps, then the problem is likely not just aging. It's what your body is missing every single day. These deficiencies are not rare. They are widespread, especially in the United States, Canada, Australia, and the United Kingdom, where soil depletion, poor food choices, overprocessed meals, and medications are stripping these nutrients from millions of people daily. Each vitamin plays a role in a different part of leg health: nerves, circulation, muscle strength, joint integrity, tissue repair, and together, they form the foundation for true recovery. When you hear people in the United States talking about restless legs, swelling after long flights, or shooting pain when standing, it's easy to assume it's just aging, poor shoes, or too much time on your feet. But what's often missing from the conversation is the long-term impact of micronutrient deficiencies, especially when it comes to vitamins that directly control nerve health, blood flow, oxygen delivery, and inflammation in the lower body. This is not just a theory. It's happening across millions of households, especially where processed foods dominate the daily diet and nutrient density is low. These are the exact situations where leg pain begins quietly but gets worse over time until walking, sleeping, or even standing becomes a painful struggle. Let's go deeper into vitamin B12 because the damage it causes when lacking is often irreversible. Many people report that their feet feel like they're walking on glass or their legs feel weak like jelly. In older adults across the United States, these symptoms are often written off as age-related, but a shocking number of people in nursing homes or on long-term medication have severe B12 deficiencies without being diagnosed. And while some forms of B12 supplementation are common, most are cyanocobalamin, which is poorly absorbed, especially in people with digestive issues or older age. That's why methylcobalamin or hydroxycobalamin is preferred. If you're dealing with diabetes, especially type 2, you should know that metformin, the most prescribed medication for this disease, directly depletes B12, setting the stage for progressive nerve damage in the feet and lower legs. In fact, many Americans with painful neuropathy are simply low in this one vitamin. Now look at vitamin D3 again from a hormonal angle. Vitamin D is not just a vitamin. It behaves more like a hormone that affects over 1,000 different genes, many of which regulate muscle contraction, pain sensitivity, and inflammation. This is especially relevant to African American populations in the United States, where melanin reduces vitamin D synthesis from sunlight. Deficiency here results in deep muscle fatigue, chronic leg pain, and slow injury recovery, even in young or active people. Athletes in the United Kingdom and Canada are now being tested routinely for vitamin D because of how often it links to stress fractures, ligament injuries, and poor post-workout recovery, especially in the legs, where power and endurance rely on calcium regulation, which is impossible without D3. Moving to vitamin K2, the importance of this vitamin grows with every passing year, especially for people taking calcium supplements, which is extremely common in postmenopausal women in the United States. Without K2 to guide calcium into the bones, it ends up in soft tissue, arteries, veins, and muscle fascia, especially in the lower extremities. This contributes to vascular calcification, where the blood vessels in your legs literally harden and restrict blood flow. The result is that oxygen struggles to reach the toes, ankles, and calf muscles. This is one of the silent causes behind intermittent claudication, the leg pain that flares up when walking and goes away at rest. It's terrifying because it signals severe artery damage, and yet it often goes untreated. In fact, many in Australia are being misdiagnosed with sciatica when the real issue is blocked leg arteries due to low K2 and unchecked calcium buildup. Supplements that combine K2 with D3 are proving more effective at reducing arterial stiffness and improving long-term leg health than either vitamin alone. Then there's vitamin B1, which deserves far more attention, especially for those struggling with burning, tingling, and aching legs at night. Thiamine helps convert sugar into fuel, but more importantly, it protects the nerves from glycation damage, which happens when sugar binds to proteins and literally fries the nerve endings, especially in the legs and feet. In the United States, where processed carbs, sodas, and sugar-loaded coffee drinks dominate daily habits, this nerve damage is happening in younger and younger people. What makes B1 different is that its fat-soluble form, benfotiamine, can cross the blood-nerve barrier and start rebuilding damaged nerve fibers, something that's essential for reversing diabetic or alcoholic neuropathy. Research shows that people using high-dose benfotiamine report significantly reduced symptoms like electric shocks, heat sensitivity, and shooting leg pain, often within just 6 to 12 weeks. It's not magic. It's targeted repair. Let's not underestimate vitamin C either. Inflammation in the legs, whether from poor lymphatic drainage, injury, or post-surgical recovery, creates oxidative stress that slowly eats away at the strength of the blood vessel walls and connective tissue. Vitamin C is the foundation of collagen production, which means it literally rebuilds the matrix that supports the skin, veins, tendons, and cartilage in your legs. Without it, you'll see early signs like easy bruising, slow wound healing, or tiny purple veins crawling across the calves and ankles. But over time, that degrades into leg ulcers, venous insufficiency, and permanent tissue breakdown. In people who sit all day for work, especially in desk jobs across the United States, the lack of circulation makes this damage happen even faster. Vitamin C also boosts nitric oxide, supporting the expansion of blood vessels and helping reduce chronic swelling in the ankles and lower legs. These are real visual changes you can often see within months when vitamin C is optimized. Now zoom in on vitamin E, and not just any form. The real game changer is tocotrienols, not the synthetic alpha-tocopherol found in cheap multivitamins. Tocotrienols work at the cellular level to prevent lipid peroxidation, a process where fats in the body oxidize and cause cell damage, especially inside the delicate blood vessels of the legs. They've been shown in studies to reduce plaque in arteries, calm nerve inflammation, and even improve skin elasticity. For people in Canada and the United Kingdom suffering from chronic leg fatigue or burning feet that don't respond to treatment, tocotrienol-rich vitamin E can support both nerve regeneration and vascular function. These are nutrients that help people regain not just comfort but mobility, which is often lost slowly over time and accepted as just part of getting older. It's not. It's often deficiency-driven. We can't skip over vitamin B6 either, especially in its P5P form. This version is needed for the production of neurotransmitters like serotonin and GABA, which affect pain processing in the spinal cord and brain. People with B6 deficiency often report shooting nerve pain, restless legs, and muscle twitching, and it's very common in people on medications like antidepressants or birth control pills, both of which deplete B6. In the United States, many doctors don't test for B6 levels despite clear symptoms. It's even more critical to monitor this in people with autoimmune conditions or fibromyalgia, which are common in women between 30 and 55 and often come with unexplained leg pain, cold limbs, or tender pressure points along the thighs and calves. Correcting this one vitamin can significantly reduce symptoms and improve quality of life. Then there's folate, but again, not folic acid. Most people in the United States consume folic acid through fortified grains, but nearly 40% of the population has an MTHFR gene mutation that prevents them from converting it to methylfolate, the active form that works in the body. This is critical for detoxification, homocysteine clearance, and nerve repair. Without enough methylfolate, blood vessels become inflamed, nerve cells lose repair capacity, and your ability to make red blood cells drops, leading to fatigue, pale legs, and reduced oxygen supply to muscles. This is why so many people who look healthy on the outside are dealing with leg heaviness, cold feet, or slow exercise recovery. They're chronically under-oxygenated. Methylfolate supports capillary regeneration and helps rebuild vascular health from the inside out. Revisiting vitamin A, it's important to understand its role in cellular renewal. Every inch of your leg tissue, from the surface skin to the inner blood vessel lining, depends on vitamin A for regeneration. In people with chronic wounds, skin ulcers, or recurring infections in the legs, low vitamin A is often the unspoken culprit. In many cases, this deficiency coexists with zinc deficiency, which compounds the immune weakness and slows healing dramatically. In the United Kingdom, where low-fat, low-cholesterol diets have become popular for heart health, vitamin A intake has plummeted, causing silent deficiencies in people who think they're eating well. The reality is that real vitamin A comes from animal fats, especially liver, egg yolks, and cod liver oil, not from carrots, which only supply beta-carotene, and not everyone can convert it effectively. Finally, vitamin B2 plays a foundational role in mitochondrial energy production. People who experience chronic leg fatigue, especially with climbing stairs or standing for long periods, may not realize their energy metabolism is broken at the cellular level. B2 deficiency shows up subtly: muscle soreness, eye strain, burning, sensations in the skin, or even cracked lips. But it points to a systemic failure in energy delivery, and for the legs, this is critical. In the United States, where stimulant use like energy drinks or coffee is high but nutrient intake is low, this imbalance leads to long-term exhaustion in the lower limbs. Riboflavin also supports other B vitamins. Without it, nothing in the D. Methylation cycle works properly. That means homocysteine builds, inflammation increases, and pain flares up in the legs over and over. Each one of these vitamins holds a unique role in the full spectrum of leg health, from nerves and muscles to blood vessels and skin regeneration. In countries like the United States, Canada, Australia, and the United Kingdom, where food supply is increasingly processed and nutrient-sparse, these deficiencies are stealing mobility, energy, and quality of life without people realizing the root cause is something so simple and correctable. This isn't just about supplementing blindly. It's about using targeted nutrition to restore every layer of your leg function and stop the pain, swelling, and dysfunction before it turns into disability.